Over the past year, New York City's Administration for Children's Services, the ACS, has been under fire for its failure to prevent child abuse fatalities. And as the new commissioner begins the daunting task of fixing the ACS, the need seems more critical than ever, since there are now nearly 250 cases of child neglect and abuse reported every day in New York City. While the Administration for Children's Services is the city's child protective service system, some of the most severe of those cases of abuse are referred to the New York Society for the Prevention of Cruelty to Children, a nonprofit private agency working alongside the ACS. The society, which was founded in New York City more than 140 years ago, is the first and oldest child protective agency in the world. And its mission is to meet the urgent needs of the city's most vulnerable children and help keep them safe from abuse and neglect. To talk about this very important issue is the executive director of the New York Society for the Prevention of Cruelty to Children, Dr. Mary Polito. Dr. Polito, welcome to the program.
Thank you so much for having me.
So let's begin at the beginning. How did your organization, how did the society get its start?
The New York Society for Prevention of Cruelty to Children was started right here in New York City in 1875 in Hell's Kitchen. There was a little girl named Mary Ellen who was being horribly abused. And there was a church worker named Etta Wheeler who heard of the abuse, but she didn't know what to do. Because in 1875, there were laws to protect animals, not laws to protect children. So she actually went to the ASPCA and met with two attorneys, Henry Berg and Elbridge Gerry. They sent people in to rescue little Mary Ellen, and then the ASPCA attorney, Elbridge Gerry, founded the NYSPCC and wrote the basic tenet of child protection laws that are still on the books today. So the child protection movement started right here.
Yeah. So before 1875, a cruelty that you could commit on a child, you couldn't commit on an animal.
That's correct.
Oh, my God. So listen, I briefly touched on it in the introduction about the mission of the society, but I wonder if you could elaborate what it is and how it has evolved over the years.
Sure. Well, initially, we were ACS before there was ACS.
Yeah, right.
So over our history, we have investigated over 650,000 cases of child abuse and neglect involving 2 million children. Then in the 1970s, the government, realizing how widespread the problem was, took over that investigative removal. And then SPCCs, which by that time had flourished throughout the United States, either went out of business or changed their mission and their focus. So today, we provide mental health counseling and healing for children that have been abused. If children are removed, we work with the families and the children to repair and restore those relationships in our supervised visitation program. And we offer services. I think the most important, one of the things we offer is prevention services. We are in the schools every day trying to teach children and parents and teachers how to recognize and report child abuse and how to prevent child abuse.
So you also help caseworkers and first responders who are really subjected to trauma of seeing these terrible things every day. You help them cope with it.
Yes, yes. We run the crisis debriefing program for New York City Child Protective Services and for sometimes horrible things happen at foster care agencies as well. And we work with them on their stress management, on coping skills, and helping them focus on what they need to do so they can come back and continue to do these difficult jobs day in, day out.
We have less than a minute left, and I want to get into your Safe Touches program. What is that program?
Safe Touches is an amazing program. It's our child sex abuse prevention program for kindergartners through the 3rd grade. It teaches children the difference between their private parts and not private parts, who can touch them, safe touches and not safe touches, and what they can do if they receive a not safe touch. We're in the public school system every day. We've reached over 25,000 children, and it's critical that we get to these children when they're young, because the average age of a child being sexually abused is 8. So we need to get to the kindergartners and really, they understand these concepts. It's evidence-based. We had an NIH grant that really went in and looked at how are they learning, and the kids are learning and they're retaining it. So I think that, this is, you want to prevent. I don't want the children coming into my clinic. I want to prevent them from coming into my clinic.
Well, Dr. Pulido, thank you so much for coming, and you do tremendous work, and we appreciate that as well.
Thank you.
For more information on the New York Society for the Prevention of Cruelty to Children and its resources, please log on to metrofocus.org.